and this really isn't even the half of it. There's a lot more types of anemia, but these are the most important conditions. So anemia basically just means that you have either a low number of red blood cells or a low amount of hemoglobin in your blood. So the three major types of anemia include microcytic, macrocytic, and normocytic anemia. Now those different types are referring to the average size of the cell measured by the mean corpuscular volume, the MCV. So the normal red blood cell is between 80 and 100 on the MCV, and so anything smaller than that would be microcytic, anything bigger than that would be macrocytic. So let's start with the microcytic anemias. Why would you have a small red blood cell? Well, usually it involves making new red blood cells, and a lot of these different anemias have to do with dysfunctional production of red blood cells. But the first one here, iron deficiency anemia, it's because of a lack of iron, which could be for many reasons, whether you're not getting enough iron in, or you're losing a lot of iron due to chronic bleeding, or you are just not able to make enough crud. So there's only two reasons why you wouldn't have enough iron. One of them is that you're not getting enough in your diet, or you're losing too much. So this happens a lot with older people that aren't eating well, or it happens with people who are bleeding a lot. You know, if you have a heavy menstrual period, or if you're just using too much of it, like during pregnancy you're using a lot of iron, that can lead to iron deficiency anemia. So if you have low iron, of course, you're not going to make as much heme. So if you're not making as much heme, then you end up with smaller red blood cells and a smaller amount of red blood cells as well. So the other thing that you often see with iron deficiency anemia is the Plummer-Benson syndrome, which involves esophageal webs and atrophic glossitis. So you see those three things together, then iron deficiency anemia, esophageal web, and atrophic glossitis. And then alpha thalassemia is caused by a defect in the alpha globin gene. So if you have less alpha globin synthesis, again we're going to have less stuff to make red blood cells, and same with the beta thalassemia beneath it. So there's a few different categories of alpha thalassemia. One of them is if you have just one or two genes, deletion of one or two genes on the alpha globin genes, then you usually don't show up with any problems. But if you have three genes that are deleted, then you're going to end up having HBH synthesis. HBH is another form of hemoglobin monomer, and so if you have a lot of HBase, if you have deletion of those three genes, then you get HBH disease. Then if you have deletion of the four genes, then that's incompatible with life. You're going to have formation of HB Barts, hemoglobin Barts, which causes hydrops fetalis. With beta thalassemia, you have the same kind of thing. If you have a heterozygote, it's not going to cause a whole lot of problems. But if you have a homozygote, then you end up with a lot more problems. So then the diagnosis is confirmed by hemoglobin electrophoresis. With lead poisoning, you're inhibiting the ferrochelatase, so and the ALA dehydratase, which also decreases heme synthesis. So pretty much all of these so far have been a decrease in heme synthesis. And sideroblastic anemia is no exception. It's a hereditary defect in delta aminolevulinic acid synthase, and so that's an X-linked deficiency, and you treat that one with B6 or pyridoxine. The reversible causes